BCEN test prep exam answers. Question 1. Meningitis is an inflammation of the Option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, a ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 2. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction. Option B, arm held in external rotation and slight abduction. Option C, patient unable to flex the elbow. Option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. Question 3. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Testicular torsion is a surgical emergency that requires intervention within Option A, 24 hours. Option B, 4-6 hours. Option C, 2-3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 5. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 6. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 7. The antidote for acetaminophen overdose is Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenol. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Question 8. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A, a damage above the midbrain. Option B, a damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. A patient leaving against medical advice, AMA, must be informed of Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 10. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, a complete blood count. The correct answer is option C, CT scan of the abdomen. Question 11. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is Option A, forcing oral fluids. Option B is straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Question 12. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 13. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects. Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. Question 14. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Question 15. A female patient of childbearing age with abdominal pain should always be evaluated for Option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Question 16. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 17. A hyphema involves Option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 18. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A positive Kernig's sign is suggestive of Option A, a cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Question 20. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of Option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. Question 21. Priapism is a urological emergency characterized by Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 22. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 23. Murphy's sign is used to assess for Option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Question 24. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss tear. The correct answer is option B, esophageal varices. Question 25. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection.